Thanks, Gerda and Doris, for the warm invitation to attend the 6th Annual Elder Care Think Tank. I'm really sorry that the duties of the campaign make it impossible for me to be there with all of you today. I hope by now you've had a really good chance to understand what we're trying to get at with our government's Aging at Home strategy announced in August. You know, one of the early and most powerful lessons that I learned in my role as Minister of Health was from a group of seniors when I was a little too dedicated to talking to them about long-term care without properly acknowledging the extent to which their most fervent desire is to live on in the home that they know for all of their days if possible. Dignity and independence as the cornerstones of that kind of living. $700 million over 3 years is going to provide a tremendous new range of opportunities for elders in the province of Ontario to receive the care and the love, I dare say the love and commitment of community, most properly delivered alongside it. We won't just be looking for solutions that are about more services from community care access centres and home care. Of course, that's an important part of the mix. We won't just be talking about more places where elder people can gather and to find community and to have good quality social engagement through the day. We will be talking about the things that we can do to unlock the enormous capacities of communities to care for and to nurture themselves in a way that recognizes the cultural diversity of the province of Ontario, so that the Vietnamese senior might have the benefit of some engagement from the youngster from the Vietnamese community, attending to their needs like shoveling their walk or going to get their groceries. These are the kind of connections that we think are possible through our Aging at Home strategy, and why we've made sure that 20% of the overall resource is dedicated to those more informal organizations that are so vital and so vibrant across this vast piece of territory that we call Ontario. I want to thank all of you for the passionate work that you've done to make sure that as our aging society is more and more our reality, that we've done our best to maximize the prospects for good quality of life in those final years. And I think that we've made some progress and that we have before us now a really big step that can make Ontario a leader, to make Ontario a leader in the way that we support our aging folks alongside the kind of progress that we've made in our end-of-life strategies, which have done so much to unlock the potential of the voluntary sector, as an example. So I thank you for coming together and for all the work that you've done. Like I said, I'm sorry that I'm not able to be there with all of you today, but I'm working hard out here on the hustings in the province of Ontario in support of my leader and our Premier Dalton McGuinty, in the hopes that we will have, alongside all of you, the continuing privilege of governing in the province of Ontario and lending shape and informing the way that community and the instincts of community for love are at the center of our healthcare system. We're a government that believes fundamentally that Medicare is the best expression of Canadian values, and we're out here on the hustings fighting for the privilege of continuing to move forward with the development of a public healthcare system that builds on these values. Thanks so very much for your dedication to all of these folks in the province of Ontario. We look forward to a continuing partnership. All the very best.